Hi, I'm Val Wolf from the Hamilton Clinic of OCOW, the Occupational Health Clinics for Ontario Workers, and I'm here with my colleagues Eduardo Huesca and Michelle Tu, and one of our physicians, Dr. Donald Cole, to present some information about COVID and in the context of worker supports and information. And it's meant to be, maybe you can flip to the agenda. This is who OCOW is, which maybe I'm not following my own agenda, but just for those of you who don't know us, we are an occupational health clinic funded through the prevention system, and our mission is to protect workers and their communities from occupational disease, injuries, and illnesses, and to support their capacity to address hazards and promote the social, mental, and physical well-being of workers and their families. And we have 7 clinics across the province, as well as a provincial office in Toronto. So the agenda on the next slide, just introduced for this afternoon, is that we have partners with us today from the Ministry of Labour, Training and Skills Development. And we're going to frame their presentation on COVID-19 and the role of workplace parties, and also what they've learned in the couple of months that they've been running an initiative on farms with respect to temporary foreign agricultural workers. And we're going to do a bit of an intro about our migrant farm worker program. Also, Dr. Donald Cole has written an occupational medicine perspectives on the heightened COVID-19 risks to temporary foreign agricultural workers, and he's going to mention a few things from that document, which is on our website. And then we will hear from the ministry, 3 speakers, Ron Landry, Vince Latona, and Denise Matz. And then Eduardo will take us back through sort of what does this mean from a worker perspective, what can we learn from it, what more can we do, and then Michelle will share information about healthcare, because there's an intersection between sort of labor regulations and issues and health regulations and issues when it comes to a pandemic. And also WSIB and income protection, because that is also a very real concern for workers and for employers, and it is part of the equation. And then we hope to have time for discussion and feedback at the end, with all of the presenters still available. So I'm going to turn it over now to Eduardo. Thanks. And I am going to turn off my camera and would ask everyone else to do so as well, just to maximize our audio quality, because we're using less bandwidth. Thanks.
Great. Thank you, Valerie. So we just wanted to start with a worker recognition and thank you message, in case there are any workers that have joined us today, and for the rest of us to take a moment to contextualize our work and today's presentation. So thank you for the work you do. We want to ensure that you have a safe season and are reunited with family and loved ones in good health. We want to wish a safe recovery to the farm workers who are currently ill with COVID-19, and thank the healthcare providers who are currently looking after them. We give our condolences to the families and loved ones of the farm workers who have passed away from the virus. We know, I think recent reports have identified 3 people who have passed away. And thank you for everyone here for joining us. And really the motivation is to work together to stop future COVID-19 infections among farm workers. So we wanted to give just a really brief review of OCOW's experience working with migrant workers or temporary foreign agricultural workers. So we also, just really quickly, there's been some talk about how there's been a shift in how we speak about these communities or identify them. Some folks are still using migrants. There's also a shift from some folks to temporary foreign agricultural workers. We have heard that some people identify migrant as an offensive term, so we really want to clarify that. We hadn't really heard that, but this is something that maybe we need to at some point acknowledge and maybe probably take cue from worker communities themselves. But just to point it out there, we mean no offense. So our work with these communities started in 2006 through running mobile occupational health clinics in community settings, where our occupational health physicians and nurses, like Dr. Donald Cole and Michelle Tu, who will be speaking, would see workers presenting with or providing consultation on health issues workers believed were related to their work. And we ran those clinics in main agriculture regions and really got to learn about the occupational health issues that these workers are experiencing. From there, we developed occupational health and safety prevention-based workshops to speak to workers about the health issues and some of other workplace hazards in agriculture. And we presented these workshops on farms as well as in the community setting. So over 1,500 workers have participated in our workshop across Ontario. We've also done a lot of work identifying resources, educational and prevention-based resources, and circulating these resources quite extensively through the province and to worker communities through events such as health fairs in various community levels as well. Our work has taken us to do a lot of collaborative work with other organizations, agencies, community health centers, researchers, and other health professionals as well. So we've gotten to be part of also great work led by a lot of you that might be tuned in as well. So we just wanted to give a really quick background a bit about how this webinar came to be. So we should probably have asked her to speak directly, but Christy Eve, the Ministry of Labor Vulnerable Worker Specialist, was an important catalyst to this. So we have worked with Christy for quite some time, and she has also worked with the farmer-employer community, or works with the farmer-employer community through way of the ministry's Technical Advisory Committee for Agriculture. So Christy had connected me with Stéphane Laraz from the OFVGA, who has also been working very hard to get resources and information to his members as well. So the idea really, in light of the current outbreak and infections, as well as deaths, was to pull together key information the ministry has gathered from investigations, complaints, and inspections to understand safety breakdowns and what has gone wrong in these situations, and direct this information as quickly as possible back to the industry itself, to employers and to workers, to increase our safety attention to key areas and address gaps. So at noon, some of you may have tuned in, Stéphane and the OFVGA ran a webinar with employers, and here ministry speakers will repeat this information, but in the context of our understanding of worker experiences and needs, to spur discussion with this audience, but also it will be recorded and sent out through worker channels along with other information and resources we're putting together. But before we get to that, I do want to introduce my colleague, Dr. Donald Cole, who will provide some important background and context. Donald.
Thank you very much, Eduardo. It's a real pleasure to be here with everyone today. So a bit about COVID-19 and the pandemic we're in. COVID-19 is a highly contagious infectious disease caused by a coronavirus, SARS-CoV-2. Over 101,000 people in Canada have had the disease. About a third of those cases in Ontario. And while in certain parts of Ontario, cases in the general population are going down, the number of cases among farm workers are going up, as we probably all know. Next slide, please. So how has this virus spread? A big part of it, and people have probably seen all the information signs up, is from inhaling droplets and even smaller particles in the air after they come from an infected person who coughs, sneezes, talks, sings, breathes, does lots of regular things for people. Important thing is that smaller particles, sometimes called aerosols, can be in the air for hours. And particles or droplets which contain the virus can remain on kitchen counters, tools, for several hours up to days. Touching any one of these surfaces or breathing and then touching your mouth, nose, or eyes can cause you to be infected. And in addition, it's worth noting that touching surfaces in washrooms and being in washrooms, because the virus is excreted in the feces, for example, in hospitals, the air in toilets and washrooms actually is higher in COVID or SARS COVID-2 than other parts of a hospital ward or the like. Next, please. So why do temporary foreign agricultural workers have a greater risk of exposure to this virus? First is that agricultural tasks, such as these workers weeding in a field, as well as the tools they use, those same hoes can be shared by a number of workers who may or may not be wearing gloves. All those can kind of put workers in proximity. Some equipment, like planting equipment, some of the harvesting equipment, is actually designed with workers quite close together. Unless, like some of the innovations that have been happening on farms, unless there are plexiglass protections between workers that are on, let's say, a planter, then the virus can be transmitted and the workers are in quite close proximity. The other thing is that most agricultural work is outside in the fields, although clearly some is also in greenhouses, etc. But that means that soap and water for washing is not as readily available. Workers who are from Mexico, the Caribbean, and the like also share housing. It may be a house, but it could be a bunkhouse. Often, historically, they've been somewhat cramped. And a number of workers share washroom and kitchen facilities. And this is one of the areas of debate, how many workers can be in a particular kind of housing safely. So we can talk a bit more about that if people have questions. Group transportation, such as minibuses to and from the agricultural workplace, is also an area where people tend to be closer together, and certainly some farms have developed distancing protocols the same way we have in public transportation and the like, but that's a routine part of their work. And that's also true for local workers hired through contract agencies that can also be shipped to a farm. Temporary foreign agricultural workers also go into town for supplies and services, and they therefore mix with people in the community, as well as fellow workers who may be hired locally. So there's lots of interaction on a farm and in a greenhouse that can place workers in close proximity unless protocols are followed. Next, please. Because this virus has spread from person to person or person to the environment to people, those in enclosed areas are at higher risk. And as we know quite well now, that people can be infected and not actually feel sick. That's either because it's before they're going to get sick, pre-symptomatic, or they just never feel sick. They're asymptomatic. So unless there's testing, like in the picture you see here in the Windsor-Essex area, agricultural workers who are infected but don't feel sick won't necessarily be detected and alerted to that fact. And it's only recently that agricultural workers have moved up the priority list to be among those, to be tested for the virus proactively, such as has been happening in long-term care homes and the like. The other thing is that workers who are sick, they may fear losing wages. We've known that for some time, and potentially reprisal and being deported once they're sick, being sent home. So there's certainly not historically been a great incentive for workers to report their illnesses. Further, some supervisors may take mild sickness reports insufficiently seriously. For example, saying it's a cold or allergies, or maybe they're affected by the heat, the like. And this is a concern we've heard from some workers, that their reports of sickness haven't been taken seriously. Next, please. So what are the signs and symptoms of COVID-19? It varies a bit by population and age, but in the working age population, this is a fair representation from the WHO. The most common ones on the left, fever, dry cough, tiredness, and then a bunch in the middle that can also occur, some of which are quite characteristic of COVID-19, like loss of taste or smell. And then on the right, you can see the really serious symptoms, which can have occurred to some of the workers who have ended up in intensive care units and the like. Next, please. So how many cases are there? It's hard to know exactly, but it appears to be about 500 to 700 temporary foreign agricultural workers who have been diagnosed with COVID-19, and at least 9 outbreaks on probably, when you add together the individual workers that have tested positive, it's about 15 of the 1,300 agricultural operations in Ontario. You can see the main areas affected there. What it does mean is that lots of places, lots of agricultural operations have not had COVID cases, which is the good news, and either due to not having infected workers on site or really good practices. So part of the purpose of this webinar is to talk about some of those and what can be done to keep many of the workers, agricultural workers, healthy. Next, please. I think this is over to you, Eduardo.
Sorry, my fingers aren't doing so well on the control. No, so this is a segue over to me. So it's Val again. Just, I think, framing as many people know, in fact, probably everyone in the call knows that there's an abundance of guidance from all levels of government, public health, other ministries besides the Ministry of Labor, sector associations, the federal government, and elsewhere. We actually just put some guidance from the CDC on our website this morning. So there's an abundance of information provided to employers, but we are recognizing that outbreaks are happening, and it is vital to figure out what went wrong, where there were outbreaks, so that we can learn from that in order to enhance future prevention. So that's one of the reasons for this presentation, and particularly for the involvement of the Ministry of Labor Training and Skills Development, who will share some of their recent findings from their enforcement initiative and from investigation of illness. So we're going to change presenters to Ron Landry now from the Ministry of Labor, and he will introduce his colleagues as well. Thanks. Meanwhile, we're looking at Donald. Good. Ron, I can't hear you. You have to unmute.
Can you? Oh.
Yes.
Okay. Just give me a minute to bring this up.
Yep.
Okay. Everyone see that good now?
Yep. It looks good. Thanks.
I'll get started. Thank you. Okay, so my name is Ron Landry. I am the Provincial Coordinator for the Industrial Health and Safety Program of the Ministry of Labor Training and Skills Development. Further along in this presentation, we'll be joined by Vince Latona, Occupational Health and Safety Manager, and Denise Matz, Infection Control Consultant. So this resource does not replace the Occupational Health and Safety Act and its regulations, and should not be used as or considered legal advice. Health and safety inspectors apply the law based on the facts in the workplace. This resource does not replace the Occupational Health and Safety Act. It is the responsibility of workplace parties to ensure compliance with legislation. This document does not constitute legal advice. So Ministry of Labor Training and Skills Development, formerly known as Ministry of Labor, is our mandate is the Occupational Health and Safety set, communicate, and enforce the Occupational Health and Safety Act and its regulations. So the Occupational Health and Safety Act applies to farming operations that have workers as defined under the Act. This includes temporary foreign workers. Give me 1 second here. So the Ministry of Labor Training and Skills Development works with system partners to develop and implement health and safety awareness and training programs to reduce and prevent fatalities, illnesses, and injuries in the workplace. As you see on this page, there's a number of our partners that we work with on a regular basis, and they all have their individual websites with all sorts of resource information, contact information, guidance that you may find useful in your situation. So some of the objectives of going through this information is looking back at lessons learned from the last 3 months of our on-farm activity during the pandemic. We'll be highlighting the importance of reporting on the part of all workplace parties, including the Internal Responsibility System, or IRS as we tend to refer to it, and also to provide further education, support, and compliance assistance to employers and workers regarding reporting requirements and the Internal Responsibility System. So since the onset of the pandemic, we've been providing education, advice, support, and enforcement regarding the health and safety of agricultural workers in Ontario. The Ministry has been working closely with the Ministry of Health, Public Health Ontario, local public health units, health and safety partners and associations, farming stakeholders, Employment and Social Development Canada, and various ministries and others as need be. In an effort to reduce the burden of overlapping inspections, the Ministry has been sharing information on temporary foreign agricultural worker inspections with our federal counterparts in the Temporary Foreign Worker Program and various public health units. We continue to explore ways to improve the information and program delivery, not only with the Ministry of Labor, but also with our partners, trying to ensure that we are coordinating our activities with engaging farm and agricultural stakeholders. So in an effort to provide education, support, and compliance assistance to employers in the ag sector, the Ministry is currently conducting proactive occupational health and safety visits to farms, greenhouses, and other locations where agricultural workers, including delivery persons and cleaners, are working on farming operations. So during this initiative, our Ministry inspectors continue to enforce the Occupational Health and Safety Act and its regulations, including but not limited to the following: the Occupational Health and Safety Act, Farming Operations, Reg 414, Occupational Health and Safety Awareness and Training, Reg 297, as well as emergency orders made under the Emergency Management and Civil Protection Act. All measures taken to prevent the spread of COVID should also be done in compliance with public health directives and guidance issued by Ontario's Chief Medical Officer of Health and the Ministry of Health. Now, as you'll see throughout this presentation, wherever you see the underline in the blue font, that these are links that are provided through this document, which will be distributed after the presentation, so you'll have access to all of this information. So the focus of the Temporary Foreign Agricultural Workers Initiative, Ministry is currently using the existing General Duty Section 25(2)H of the Occupational Health and Safety Act to require employers to take every precaution reasonable in the circumstance for the protection of a worker from COVID-19 in the workplace. It includes a focus on screening to prevent workers who may have COVID-19 from coming to work, physical distancing, a 2-meter separation between workers, proper on-site hygiene, engineering controls, and other precautions, including the use of personal protective equipment. The Ministry also employs a team of specialists that may accompany an inspector to provide additional expertise. These professionals include engineers, hygienists, doctors, ergonomists, and radiation experts. They may also bring or make referral to the local public health unit as deemed appropriate. So as of June 17th, across the province, the Ministry has received 60 complaints associated with a farming operation and conducted 202 inspections 123 proactive, and 79 reactive. So the 123 proactive is unannounced, typically inspections where we show up at the farm and conduct an inspection. 79 reactive would be as a result of us receiving a complaint of some nature regarding the workplace. So anybody that works there can call in a complaint, as well as anybody else who may believe that there's some unsafe activity at that farm. You don't have to even be a worker. You can call into our call center, and I'll provide that information later on in the presentation. So there have been no work refusals related to COVID-19 in the farming ag sector. Where noncompliance is observed, inspectors can issue orders, and we have issued 63 orders, and 12 of those were related to COVID-19. So overall, just kind of speaking to the theme or the types of orders, the nature of those orders issued, information and instruction being provided to workers, screening, physical distancing without other controls in place, and cleaning and disinfecting of high-touch surfaces and common areas. The Ministry has also received 13 occupational illness reports as required under Section 52(2) of the Act, and I'll go into that a little more later in the presentation. I'll hand this over to Vince from our district office in Windsor. And Vince, I'll flip the slides as you let me know when you want them changed.
Thank you, Ron. Hi, everyone. Thank you for inviting me to participate in this webinar. My name is Vince Latona. I'm the Acting Manager for the Ministry of Labor, Training and Skills Development in the Windsor District Office. I've been with the Ministry of Labor for approximately 10 years with previous positions as a construction inspector and more recently, construction program coordinator for the Western region. I do have some extra information that I'll speak to on each slide. Excuse me. When I'm finished, I'll give you the cue, Ron, to advance to the next slide, if that's okay. So you can go ahead and proceed to the next slide. The Windsor District Office boundary includes Essex, Chatham, Kent County, and stretches across Western Ontario to the London borderline, just north of Wallsburg, Dresden, and Dutton counties. In 2020, Ontario anticipated just over 20,000 temporary foreign workers to fill positions in the farming and agricultural sector. Nearly half of these workers came to Windsor, Essex, and Chatham, Kent areas. Over 200 farms applied for the temporary foreign agricultural workers in the Windsor, Essex, and Chatham, Kent areas. In the province of Ontario, the Windsor office is uniquely situated in an area where the majority of the province's greenhouses are located, which see a significant number of temporary foreign agricultural workers come to the area each year. Last year, approximately 3,000 temporary foreign agricultural workers were working on greenhouses and farms throughout the Windsor area. Next slide, please. As part of the Ministry of Labor's Temporary Foreign Agricultural Worker Initiative, as of June 17th, 2020, Windsor District Office has completed 60 field visits to over 50 farms. 13 field visits were reactive as a result of formal complaints. Ongoing investigations include 2 of the recent fatalities suspected to be COVID-19 related. The Windsor office maintains weekly contact with Windsor Essex County Public Health Unit to help prioritize proactive visits to farms with suspected outbreaks. We also have a close working relationship with the local consulates in the area. As of June 22nd, which is today's date, we've now performed 71 field visits under this initiative. That includes going out after hours and during weekends. Next slide, please. Based on data collected, an overwhelming majority of farming operations that have experienced outbreaks were using short-term contract workers hired through temporary agencies. In an effort to address some of the unique challenges experienced in Southern Ontario, inspectors in the Windsor District Office have begun conducting visits to short-term employers who provide temporary workers to the farming community. Short-term workers who visit multiple workplaces over the course of time are potential vectors for transmitting the hazard of a virus. Even Ministry of Labor inspectors are also vectors for transmission and must take extra precautions when we visit workplaces. Whether it be a greenhouse, farm, or temporary agency, all of these are employers and have responsibilities under the Occupational Health and Safety Act. When it comes to information, instruction, supervision, and training, all employers have the same responsibilities to take reasonable precautions to protect their workers. Inspectors are asking specific questions regarding working arrangements to ensure adequate safe working procedures and COVID-19 related measures are in place for all workers, including those brought in to assist for short duration work. Isolation procedures, screening measures, and maintaining physical distancing, bunkhouse accommodations, personal protective equipment are some of the topics thoroughly discussed for each visit. I don't want to be too redundant because we're going to share a lot of considerations that we look for throughout this slide. However, in our discussions, we also consider things like transportation of workers, alternating work via shift, the use of barriers, or commonly what's used is plexiglass screens, and even temporary workstations. Inspectors will assess the workplace in person and ask specific questions to ensure adequate precautions are being taken with respect to COVID-19. We'll issue a field visit with all the points discussed and even orders for compliance under the Occupational Health and Safety Act if necessary. That concludes my slides. Thank you for having me. And unfortunately, I'll have to jump off, but I know my counterparts will be happy to answer any questions that you may have. Thank you.
Thank you, Vince. Now we'll go ahead.
Thanks, Ron. Hi, everyone. I'm Denise Matz, and I'm the Ministry of Labor's infection control consultant for the Northern and Western regions. I've been with Ministry of Labor for over 10 years and providing infection control consulting both in the field and in other manners. Next slide, please. So with regards to infection control, you want to protect your best resource, and that's why we look at how to prevent occupational health infections. We know that workers are the most important resource, and we know that a healthy and effective workforce benefits everybody. The main purpose of the Health and Safety Act is to protect worker health and safety, and this includes protection from infectious diseases. So exposure in the workplace, to infections is notice of occupational illness, exposure in the workplace to infectious agents, and an infection that results as a result of that exposure is acquired in the workplace and therefore an occupational illness. We have 4 infection control consultants across the province. Normally we just have 2, but with the onset of COVID-19, we brought in 2 acting consultants to help with the bulk of issues that have come in. The role of the infection control consultants, we provide subject matter expertise and guidance to both internal and external stakeholders with regards to worker safety related to infection prevention and control, and that is for all sectors of Ontario workplaces. And you may, at times, if we come for a field visit, you may have an infection control consultant accompanying an inspector. Next slide, please. So when we talk about infection prevention and control measures, we have to think about where workers may be exposed to infections. Potential exposures can occur from infectious materials, body substances, contaminated surfaces, contaminated equipment, contaminated supplies, and contaminated environment. So those are ways that workers are exposed. So as part of your control measures to have in place, what we look for is that a risk assessment is done by the employer. And this evaluates hazards with relation to infection prevention and control. So it has to be done for all occupations, all roles, and the tasks performed. And it identifies where there may be exposures or spread of infections related to those tasks that are performed and through the risk assessment, and that would be for all workers at the workplace in the organization, and that would be for related to all tasks, and then what infection hazards present themselves. Then the control measures should be put into place, and those risk control measures would follow the hierarchy of control. So with the hierarchy of controls, we apply them to any hazard, and for respect to this presentation, it's with COVID-19. And with the hierarchy of controls, the school of thought is from the most control to the least control. So the controls in the context of infection prevention and control simply represent breaking the link of infection, how infections are spread. Keep in mind that with infections, we can't always completely control it at the source, but each individual control that we put into place is meant to minimize the risk. And that's what it's all about, is minimizing the risk reduction. With the infection control measures, it's important that organizations apply this to anyone coming in to do business at the workplace or within the workplace on site. That's not just the infection control measures and procedures do not just apply to workers and supervisors and employers. It applies to people coming on site from outside of the workplace as well. So that's an important thing to remember. And then we have to keep in mind on how infections are spread. And with respect to COVID-19, we talk about direct contact. So direct contact is something like a handshake, simple, straightforward, direct contact. Indirect contact is when it's deposited on surfaces or tools or objects. So by indirect contact, you have contact with that has been contaminated by someone with COVID-19, and then having our fingers or hands on it, and then putting our fingers into our eyes, nose, or mouth. So that's how that's transmitted. And then it's also the mode or the method of how it's spread, to be knowledgeable. COVID-19 is contact, droplet, and or airborne spread, or a combination of those. So it's important to know how it's spread, and then how you put those breaking of the chain of infection prevention links into place there. So back to the hierarchy of controls, when we're looking at those with respect to engineering controls, that would take into effect things like ventilation changes, if they can be done, or physical barriers, something like plexi barriers, or workstation remodifications or changes to allow for distancing. Many things can be done engineering-wise. Administrative controls and good work practices include policies and procedures that support those engineering controls, things like good hand hygiene practices, simple access to water and soap is effective for COVID-19, or alcohol-based hand sanitizers as well. It's not always business as usual. I mean, there could be portable water put out in fields with soap dispensers. So there are many portable measures and strategies to make sure good hand hygiene is provided. As an example, cleaning and disinfecting, very important. There is a good example of indirect contact. So again, I mentioned tools and equipment. Appropriate disinfecting solutions should be used to make sure that they have the kill factor that's required. High-touch areas should be cleaned more often, and basically within the environment, living areas, bunk areas, eating areas, wherever people have high contact while physically distancing. Guidelines for ill staff, another issue. Do workers know what the symptoms are? Do you know what the symptoms are? Are you aware of who to report them to? Are you aware of if you become ill, what needs to be done? Are you aware of if you do become ill or symptomatic or positive for COVID-19, is there a return to work process to come back to work from the employer? And then our last line of defense is always the PPE, and that could consist of gloves, masks, some form of facial or eye protection, or apparel covering. So PPE is considered the last line of defense, and it can be used singularly or usually in a combination of PPE. And then with regards to education and training, it is important that everybody gets some kind of information on safe practices for the control of infections. Again, they have to be relevant to their work and relevant to their task. There has to be awareness of the hazards associated with infections in the workplace. And this is for anybody that may be subject to biological agents or infectious disease transmission as a result of being at the workplace. With education, it's important that it is basic fundamentals that workers should understand based on the infectious disease hazards that may present at the workplace, and particularly to know how it's spread, either by contact, droplet, airborne, or the means by how the virus can move around, and understand the protective mechanisms that are in place or could be put in place to protect your own health and safety. And then evaluation is really important in workplaces to look at what's being done, if it's being effective, and if it's not effective, look at other things to do, other improvements to make, put those into place. So reevaluating on a constant measure is very important. So if things aren't necessarily working and you're still having outbreaks, it should be reevaluated to, okay, what else can we do to prevent the spread of infections? And that's it. I will stay on for questions. Ron, you're next.
Thank you. All right, so I'm going to go on. Next part of the presentation has to do with the internal responsibility system. So this basically, you know, this is how your health and safety system works at the local farm agricultural setting. So the Occupational Health and Safety Act makes it clear that employers have the greatest responsibilities with respect to health and safety in the workplace. However, all parties have a responsibility for promoting health and safety in the workplace and to help the workplace be in compliance with the Occupational Health and Safety Act. The respective roles and responsibilities for all workplace parties are detailed in the Occupational Health and Safety Act, and which is the basis for the internal responsibility system. So as you can see by the chart on the left, you know, it isn't just the employer's duty, it isn't just the supervisor's duty, it isn't just the worker's responsibility. Everyone has a part to play in the internal responsibility. So everyone has a role. So workers who see a health and safety problem in the workplace have a duty to report the situation to the employer or a supervisor. Employers and supervisors are required to address the issue and ensure that workers on a farming operation are aware of any hazards. So employers have obligations on the Occupational Health and Safety Act and its regulations to protect workers from hazards in the workplace, including infectious diseases. So some of the key employer duties are to take every reasonable precaution in the circumstance for the protection of a worker, to provide, maintain, and ensure proper use of equipment, materials, and protective devices, ensuring required measures and procedures are carried out, provide information, instruction, and supervision to workers, and to acquaint workers and supervisors with workplace hazards. So the ministry's guide is for employers, whether you're currently operating or planning for your workers to return to work. The guide will help you develop a plan to work safely. It will help prepare you to put controls into place to make the workplace safer for everyone. So the safety plan template can be accessed using the link in this presentation, again, which will be shared with you at the end of the presentation. As quickly as possible upon arrival, workers should be instructed on the fire safety plan in a language they understand. For example, some form of orientation training. And you can check the resources to prevent COVID-19 in the workplace for sector-specific information, examples of controls that apply to your workplace specifically. There's a ton of information available through the link. So what to do if someone tests positive? So under the Occupational Health and Safety Act, subsection 52(2), if your employer is advised that a worker has an occupational illness due to an exposure at the workplace, or that a claim has been filed with the Workplace Safety Insurance Board, the employer is required to notify the ministry in writing within 4 days. So as a worker, it's very important that you let your employer know if you have signs or symptoms, or if you've tested positive, or that you have filed a claim for occupational illness with Workplace Safety and Insurance Board. And if you have any questions or would like to report an occupational illness, you can call our Occupational Health and Safety Contact Center at 1-877-202-0008. We also have an email address location that employers can use for reporting occupational illness. So there's some required information in the occupational illness notice. So generally the written notice should include the name, address, and type of business of the employer, a description of the occupational illness and what may have caused it, the period when the worker was affected, the name and address of the worker affected, name and address of the physician or other medical practitioner, if any, who was or is attending to the person for the illness, and the steps taken to prevent further illness. So failure to comply with the Occupational Health and Safety Act and its regulations can carry penalties for noncompliance. So in the event that compliance with the Occupational Health and Safety Act or an MOL inspector has not been met, the MOL can charge and prosecute a corporation or an individual. So if an individual is found guilty of an offense, it could be liable for a fine of up to $100,000 or up to 12 months imprisonment, or both. And the corporation, so basically the employer, if found guilty of an offense, is liable to a fine of up to a maximum of $1.5 million. And any inspector's decision can be appealed to the Ontario Labour Relations Board. So whenever we do a field visit, we leave a field visit report, and on the bottom of each page of that report is information on the Ontario Labour Relations Board, and an appeal can be filed within 30 days, and the appeal could be, you thought an order should be written and it wasn't, or maybe an order was written and you don't think it should have been written. So things of that nature are typically the topic of appeals. So of course, there are worker rights on the Occupational Health and Safety Act, including the right to know about hazards to which you may be exposed. Employers are legally required to provide information, instruction, and supervision to all workers and supervisors about known health and safety hazards in the workplace. They also have the right to refuse unsafe work. Employers are not allowed to fire, discipline, or penalize a worker for following workplace health and safety laws or refusing unsafe work. They also have the right to participate in identifying and resolving health and safety concerns, including issues related to COVID-19. For example, through membership on a joint health and safety committee or health and safety representatives. And along with rights comes responsibilities. So workers should follow the safe work procedures and the requirements of the employer's health and safety policy. Workers should be aware of and follow public health directives and guidance issued by Ontario's Chief Medical Officer of Health and the Ministry of Health. Again, a link provided there to visit that site regularly, checking for updates as they come about. There is regular updates. And if a worker becomes ill due to COVID-19 or experiences any symptoms, the worker should report it to a supervisor immediately so that others can be tested and further controls can be put in place to prevent spread. If a worker sees anything that looks unsafe, Not only COVID-19, but anything that looks unsafe in the workplace, they should tell the supervisor or employer right away. And the worker may also speak to a member of the Joint Health and Safety Committee or a health and safety representative. So it's always much easier to spot something, report it, have it addressed before someone gets injured or ill. So some of the differences between Joint Health and Safety Committees and health and safety representatives. So Joint Health and Safety Committee is required when there are at least 20 regularly employed workers on farming operations such as mushroom, greenhouse, dairy, hog, cattle, and poultry. And farming operations that regularly employ more than 5 workers but are not one of the 6 specified commodity groups are required to have a health and safety representative. So the following chart just goes through some of the differences between Joint Health and Safety Committee and health and safety rep responsibilities. So inspecting the workplace at least once per month. It's the same for both. Identify workplace hazards and make recommendations to the employer. Same for both. Obtain information from the employer regarding identification of hazards. Same for both. Inspect workplace and investigate following critical injuries, fatalities, or work refusals. Same for both. Opportunity to accompany the Ministry of Labor inspector during inspections of the workplace. Same for both. And committee meets at least once every 3 months and keeps minutes. That's only for the Joint Health and Safety Committee. And certified Joint Health and Safety Committee member may initiate bilateral or unilateral work stoppage if they believe that dangerous circumstances exist. Again, for the Joint Health and Safety Committee only. So as far as determining what regularly employed is, we typically consider a 3-month average. So if you have fluctuating workforce levels, look at the average over 3 months and determining whether or not the Joint Health and Safety Committee or Health and Safety Rep is required, as well as taking into consideration the specified commodity groups. So employers are not allowed to reprise against or punish a worker for obeying the law or exercising their rights. So your employer cannot dismiss or threaten to dismiss you for reporting reporting unsafe conditions or for working as per the Act and its regulation, working in compliance with the Act and its regulations. They cannot discipline or suspend a worker or threaten to do so, and they cannot impose or threaten to impose any penalty upon a worker or intimidate or coerce a worker. And if you feel that you may have been reprised against, you can call our contact center at 1-877-202-0008 or email using the email address provided on this slide. The Ministry of Labor Training and Skills Development is here to help. We have our Occupational Health and Safety Contact Center, which you can call anytime to report critical injuries, fatalities, or work refusals. General inquiries can be received between 8:30 and 5 p.m. Monday to Friday. We also have a toll-free number. When you dial that number, if you press 1 to report an accident or work refusal, press 2 to report a complaint, including COVID-19 concerns, and press 3 if you have any questions. And once you actually get to a telephone agent, so an actual person on the phone, you can ask for service in any other particular language. Just let them know and they will make the arrangements so you can communicate in the language of your choice. You can also email questions to the email address provided, and you will get a response within 5 business days. And of course, in an emergency situation, always call 911. We have a number of resources available in the ministry. Employers and workers can refer to the ministry's Guide to the Occupational Health and Safety Act for farming operations to help understand their health and safety rights and responsibilities. For COVID-19 specific agricultural resources, please visit the ministry's Agriculture Sector Guidance Notes and Workplace Safety and Prevention Services Guidance for Agricultural Workers and Agricultural Supervisors. In addition, training workbooks and accompanying guides are available for download, including Worker Health and Safety Awareness in 4 Steps, Worker Awareness Workbook, Employer Guide to Worker Health and Safety Awareness in 4 Steps, and Supervisor Health and Safety Awareness in 5 Steps. We also have a number of online resources. Employers and workers can refer to the Ministry's Guide to the Occupational Health and Safety Act for farming operations to help understand their rights and duties under the Health and Safety Act and its regulations. Ministry of Health also produced the following guidance documents: guidance for temporary foreign workers and guidance for group homes and co-living settings. Please check with the Ministry of Health COVID-19 website regularly for updates, frequently asked questions, and other information related to COVID-19. And that's the end of my part of the presentation.
The worker lens, but in the meantime, there have been a few questions in the chat box, and then we will I think these 3 questions we can maybe ask, and then we'll have time later at the end. So there's a question from Tanya about, are workers aware that they can apply for WSIB if they test positive? I know that that's a WSIB question to some extent, but does the Ministry of Labor discuss WSIB with workers and employers at all, I guess would be the question for you. And then the question about how many have applied. Tanya, I just looked it up on their website. It looks like about 353 right now, which changed from last week's. But Ron, do you have any comment from the Ministry of Labor perspective on just informing workers and workplaces about the coverage for WSIB?
Yeah, so it's obviously beyond their mandate as far as responding to the numbers being reported. I understand you've pulled some information, but yeah, I'm not. I really can't comment on what outreach WSIB has done as far as providing that information to workers in farming and agriculture. I do know that we have provided a suite of information to our inspectors, going out and delivering that information to workplace parties. So we have the field visit report, which contains, kind of a summary of what the visit was. It'll have orders and timelines for completion or compliance for those orders. But there's also a section of the field visit that is the detailed narrative portion. So in that portion of the field visit, the inspector can provide links and other resources that the workplace parties can use to further advance their internal responsibility system, which can also include, links to WSIB as an example.
Okay, thanks. And the next question is related to, I guess, classification of COVID-19 as an occupational illness. Has it in fact been named as such by the ministry? And if not, what are the plans, or does it become one by default as soon as someone gets sick at work?
So it's not like there's a list per se in the legislation as to what it is an occupational illness. COVID-19 is considered an occupational illness if it was acquired as a result of workplace exposure, or the employer is aware that the worker has submitted a claim. So we're speaking specifically to COVID-19 because that's the nature of this whole presentation. But the 52.2 requirement is for any occupational illness, not just COVID-19. So there's no updated list. It's whether or not it's an occupational illness to begin with.
Okay, great. And the last question we'll take right now, I think, is what kinds of orders have been issued around COVID-19 infection control in agricultural operations, if any?
Well, as I said earlier in the presentation, a lot of the orders that have been issued have to deal with, what are the screening techniques, cleaning precautions, education of workers. So they typically fall under one of the clauses, one of the general duty clauses in general. But we looked at overall information instruction provided to workers, the involvement of the Joint Health and Safety Committee or safety rep, social distancing, screening methods, hygiene, and personal protective equipment. Sort of that's sort of the checklist almost of things that we look at, and that may result in orders.
Okay, thank you. We will get Eduardo to load his presentation, but I see there's one more, I guess, so maybe you can answer. Just, is there a plan for the ministry to implement new guidelines potentially in light of the emergent safety agreement between Canada and Mexico? And how might this agreement be reflected in oversight or inspections?
Yeah, so obviously I've heard about the agreement. It's gotten a lot of play in the media. Whether or not it has any impact on the day-to-day operations of our ministry, that has yet to be determined. There's been no communication in that regard. So it's a wait and see.
Okay, thanks. I think we'll go on with the rest of OCAL's presentation, and then we'll have a dialogue at the end with some of the other comments and questions, Steph, if you don't mind. So we'll go ahead, Eduardo, thanks.
Yeah, we'll be definitely recognizing that there's probably a lot of discussion, so we'll try to get through information as quickly as we can. So this slide was just really meant to provide a bit of considerations from the OCAL lens, but as we know, obviously, that doesn't mean that that's the whole picture, and a lot of the audience might have great insight that are working also very directly with workers themselves, but we really wanted to touch on the fact that we really need to ensure workers understand hazards in their context and are made aware of new risks, insights resulting from procedural changes. So all this information that we've heard, this new understanding about what went wrong, we really need to prioritize on figuring out how to get that right to workers directly. Ideally, obviously, this would be a feedback loop through employers around reorientation and continuous safety communication. But as we know, we also need to go right into community level outreach as well, directly to workers who may not be getting this information. So we also have to support employers and workers to attain a level of two-way safety communication that is needed. So again, it's so clear that during this pandemic time, safety communication is of the utmost importance, and this is two-way safety communication. So it's really critical that we figure out how to really get the standards up on that. Support workers whose concerns are not being addressed at the workplace, so where the IRS is not functioning. And this is really critical because, we hear reports of workers' situations that really, we can't be, letting workers be in dangerous situations without access to guidance and support. And make, the reporting channels that we've talked about, really make them actually accessible increasingly to workers, because if this is really a route where we're being able to flag things going wrong, then we really need to use those tools, or workers really need to have access to those tools to keep using them. And as part of that, really look at anti-reprisal support and continue ensuring that this is effective. And as we all know, there's a lot of work there to make anti-reprisal protections for this population actually work. So in terms of the developing high-functioning internal responsibility, again, it's just kind of really touching on the fact that for compliance, we're really needing it to be, to safety communication really be rooted in understanding, communication, and engagement. Ensuring that this is what's happening on farms, this is the level of safety communication is critical. With understanding, we obviously get buy-in, we have that feedback loop from workers to identify and strengthen policies at the workplace level, figure out what's not working, and clarifying if there's a lack of understanding on anything. So this is key as well, because with what we sometimes see in these emergency situations is potential assertions of safety practices just based on control, potentially from the employer level. Sometimes it's understandable in a situation where you're trying to control all the risk factors. However, if that's really the way that things are happening, it really leaves room for misunderstanding, safety gaps, and risks. If again, one clear example that we're hearing is the worry about workers going off the farm or going into town because of obviously the heightened risk then of exposure from non-farm people or through their travels. So one, what we keep hearing is then sometimes workers being told that they just cannot leave the property, versus, a more effective route would be to have conversations about the importance of recreational time, the importance of off-work time, but how to do so in, a safe way. Language barriers obviously further complicate and challenge IRS and workplace communications. So that's something we need to consider. In terms of kind of how we can support, we've been really trying to figure out just some really practical guidance and tools to really improve IRS functioning on farms and help with safety communication. And, in our experience with farms, because we have worked and are invited to present information on farms and we dialogue with farms, farms are at varying levels of capacity, communication capacity and effectiveness. And, you have some doing a great job, both in English and in Spanish in terms of communicating to workers. And then you have some that communication is very minimal in terms of the capacity. So we really need to identify that people are at different places, but we really need to identify where they should all be going and the level that they should all really be able to be reached. And again, at this critical time, right? And then support them to get to that level. In terms of language support, that's crucial, right? Because on farms where you might not have, the experience with safety communication, but you add language, it obviously further complicates. So in the immediate, we really need to look at just identifying any language needs that farms may have and address that through either, professional services that are available, or we're seeing a lot of volunteer initiatives that are popping up of Spanish speakers, Thai speakers, and offering their services directly to farms. But, this really is critical to just get those resources out to farms that need them. But on a longer term basis, we really need to address the sector's language capacity and do so structurally sustained and professionally. These workers have been coming for such a long time, yet the industry, the health and safety industry, and kind of the resources around them haven't done a job to really reflect needs around language and comprehension. So one example of a structural kind of capacity building initiative, and I don't just mention it because we helped out. I kind of feel bad to highlight something that we've done, but it really did feel like it was a step in the right direction around language, but, identifying that the Ontario Pesticide Education Program had a capacity gap to be able to train sprayers in Spanish. We worked with them and they were able to develop their first Spanish-speaking trainer roster. So that was then able to be offered through farms in Ontario and actually provide that, crucial pesticide sprayer training in Spanish as well. And again, so this is just really important to understand that we're hoping that this level of communication is happening on farms, but we also recognize that, in some situations that's not happening. So we really need to, again, focus on listening to workers, worker-led, and advocacy groups that are connected to directly to workers to really make sure that we're hearing what's going on at that level and support any disenfranchised workers and ensure that no one's left, in dangerous situations. One, opportunity that we all really need to get a bit more a hold on, and I guess other different agencies are already taking steps towards this, but it's to use social media and information exchange platforms that are accessible and used by workers. So we know that there's, Facebook groups, WhatsApp, communication that's happening. So it really provides a big opportunity to send key information through those channels, and hoping that they're also reaching workers at the workplace level, but to make sure that then we're doing it at both levels. So this just really quickly, early on when this pandemic began, we really felt that there was a lack of COVID-19 resources for the worker education level in accessible formats. So when we were looking at what was being offered at the Ontario level and even at the Canadian level, there was not much. Soon there was the production of some materials by public health units, community health centers, as well as some of the health and safety associations. We put in some work to try to identify as many of these sources as we could, as quickly as we could, both Ontario, Canadian kind of produced sources, and then like what often happens with us is when we can't find the resources that are good from the Canadian level in terms of language and comprehension, we look south to the United States. So we did that. We did a review of key farm worker related and just basic COVID education materials, also from Mexico, government of Mexico as well. And we've put those together in PDF documents, and we distribute these extensively, mostly to the employer groups at first to try to really support orientation and education on the farm. And then we've started to also then prioritize circulating these just through worker channels too. We tried to categorize them by topic, and then there's also videos because again, we're really making sure that these, text heavy, really just translating a really long document is not necessarily the most useful of what we really need. Recently, we've also put together, we've spent some time, and actually for this presentation, this was the initial product that was supposed to come out of it, but we, this webinar motivated us to complete this, but this is a presentation that we're going to film where we've tried to include some key safety messages for workers, because we are finding that a lot of what everybody's discussing, it gets really into nuanced levels of safety with these communities that a lot of the materials that we're finding are not reflecting, and could also be better presented through audio and video means as well. So just to kind of show a bit of some of these materials, and we're going to actually send out a link to this complete tool to all of you as well, and we're really open to hearing feedback of what's missing, what you think needs to be added before we film, and then this will be translated into Spanish to have an English and Spanish version. But so here we really focus on key safety messages. We really try to find good infographics. So the ones above are from the Canadian Centre for Occupational Health and Safety. The other ones are from the Ontario government, and we've actually translated some of these into Spanish. So again, they really, I won't go into too much detail, and they're very obvious in terms of what they're trying to communicate. But we do go into them in the video a little bit into detail. So for physical distancing, we do talk about how, if workers get to a work task that they feel they can't maintain physical distancing, to stop what they're doing and, talk to the supervisor or employer to problem solve that, right? Because we know that there's continues to be situations where, physical distancing doesn't seem to be clear. We've also really focused on PPE use. So as Denise pointed out, we really wanted to get to the point of clarifying that that's the last line of defense, as well as the risks associated with improper PPE use. And we really focused on ensuring that workers know that their employer should be, providing them information about how to put on, use, and take off, safely remove PPE. We've talked about how it can provide a false level of security, and how there's still a heightened risk of contraction if you, for example, touch your face with gloves or touch your mask while it's on, and then just reviewing the process of putting it on, taking it off as well. Again, really trying to find visuals that can help communicate those. And again, also trying to weave in the IRS into this, saying, if you do feel like you require PPE, discuss this with a supervisor. We also, and it kind of touches a bit on the information that Denise also shared, we also really try to identify high-risk spaces in the bunkhouse. So we really also wanted to mention here that we don't want to confuse information being provided by the health units or by the employers around bunkhouse guidances guidance that's been provided, but we did want to kind of come up with very clear and useful insights that might resonate with workers around their washroom, the kitchen, the bedroom, just to really, increase understanding around the high-risk activities that could take place here, and some practical suggestions to kind of get people thinking and considering. As part of this, we also kind of reiterate that if workers have safety ideas or questions, again, always, discuss with coworkers, people that you're sharing space with, to get on the same page, as well as try to engage with supervisor and employers. We also try to tackle some of the more nuanced safety issues as well. So again, we've heard a lot about the physical distancing and safe travel during leisure and off-farm travel. So we really wanted to unpack that a bit, because again, unless there's a public health order of a lockdown in amidst a crisis, leisure time again is an important part of workers' experience to disconnect around supporting their mental health and such. So we wanted to get into that. We have a couple of slides around what to do if you're sick that I won't speak too much of, because my colleague Michelle Tu is gonna follow me to speak a bit more about that, as well as non-emergency healthcare. As we know, during this time and with heavy agricultural work and all the hazards that come with it, there will, hopefully not, but probably will be other health issues, non-COVID related or non-emergency. We do also talk about mental health. We try to really discuss and kind of address stigma around it, and really highlight how COVID has really affected the mental health of a lot of us, and that we can imagine even more so when folks are away from family, doing hard work and such. So we go into that as well, and we actually have compiled some mental health resources, general resources for the province, as well as some resources that are particular in region. But this is definitely an area that, if other people have more information, more useful, contacts, that would be great. A lot of the mental health resources we found require filling out forms. It's, we've struggled to find just direct lines, but we also include some of the volunteer-run conversational support opportunities that have popped up throughout the province as well. So we include some numbers that workers can call to sign up just to chat with somebody as well. And this is, we also then go into really talking about rights and responsibilities, the IRS, but also really situating around worker rights, the right to know, the right to participate, the right to refuse unsafe work. We have a lot of experience in this. We've presented this quite a lot to migrant farm workers in our workshops, both on farms and in the community, as part of awareness training workshops, they're called, as well as we presented this to newcomer workers. So we tend to then really talk about, whatever, if you have any question, it's your right to engage. So really trying to promote that. But then it's also recognizing that, and so we also talk about health and safety reps, joint health and safety committees, which is also something in terms of our considerations, is something that we also need to direct support for, the development of, because we know that in many places, migrant workers are not actively participating in those roles or capacity, or in those roles. And we talk about then if concerns are not addressed in the workplace, how to contact the Ministry of Labor. And we talk also about anti-reprisal protections. But again, as part of, it's very difficult to talk to workers or present to workers anti-reprisals when, we continue to really require to do work to make those actually useful for folks. So it's a bit of a challenge there. And it's something that we need to then work behind the scenes to clarify. And then lastly, we've included this phone number, an OCOW number, where we're hoping once this resource gets released, workers can call or text to, and I know that other organizations and community groups and worker groups have similar numbers, but just to kind of get any feedback on any questions around this material or identify any other health and safety information that workers may be interested in and require. So now I'll pass it over to Michelle to continue.
Hi. Okay, whoops. Hello.
We can hear you. Doing good.
Okay, very good. Thanks, Eduardo. And I'm the last speaker, just for everyone's information. So this won't take long. Eduardo's mentioned some of the material already. But as Eduardo mentioned, OCOW has a clinical role and conducted walk-in style clinics for over a decade and continue to work with community partners regarding workers' health. And the ability for temporary foreign agricultural workers to independently access primary health care has always been a challenge. And that lack of access has been highlighted during the pandemic for sure. As Donald mentioned, workers may be afraid to report symptoms to employers, or in the case where a report's been ignored. This has meant that cases have not been identified in a timely fashion, which may have led to larger outbreaks than necessary. It has also resulted in workers not receiving the treatment that they needed with resultant serious consequences. And we continue to hear concerns from workers about their health. And so the inability to access healthcare independently is in their own language to enable diagnoses of health conditions, including COVID-19, will result in better overall health for workers for sure, as well as an increased productivity. Language and barriers and systemic racism can both affect the quality of care, I think, as many of us know, and there's an increased risk of death for people people of color in most countries. And as already talked about a bit, migrant farm workers are away from their families and lacking the kind of social supports that other agricultural workers may have. And income supports during quarantine may be less than adequate. And this is a great concern for workers. And the long road to recovery in a small proportion of cases may make return to work very difficult. Next slide, Eduardo. Yeah, thank you. So this is a slide, Eduardo's already talked a bit about it, which is going to be for workers in terms of telling them about what to do if they do feel, if they do have symptoms or are concerned, and what that reporting structure should look like. That's the reporting structure that would be recommended. But in the case of severe symptoms, to identify for the workers that they need medical attention quickly. And we know that there are or were workers who did not know how to contact 911. And we've worked with Ontario EMS to prepare specific instructions for temporary workers, which should be available this week. And also guidance about what to do if their reports of symptoms to their supervisors have been ignored or not acted upon. And we've certainly heard this in some workers' scenarios. And if they had access independently to healthcare services, that would be a route that they may be comfortable to connect with. The next slide there. And Eduardo, yeah, thanks. And so Eduardo mentioned previously in terms of the fact that there are non-COVID healthcare issues that present to workers quite often, things like shoulder strain, blood pressure issues, needs for medication, etc. And so there are a number of health clinics in Ontario that offer non-emergency health services specifically for international workers. And the links that they provide in terms of how to access them do so through channels that oftentimes workers use that the rest of us don't. But it's also what's really important is that these clinics, through their understanding of the challenges and needs of this population, that they are able to facilitate care with translation and anticipate needs and provide information in a format and language that workers can access and understand. And you know, many of them have made videos and are doing Zoom consultations in some workplaces. And so they're an amazing resource, and we're going to provide a link on our website for that. The next slide. So this is just an example of some of the areas. So just the next slide, Eduardo, too, and just move on. There we go. So a couple of questions have already come up about income continuity to COVID during COVID-19. And this is a huge concern and question for workers because they are depending on income to send home to their families, as well as to support them while they're here, but mainly to send home to their families. And so likely if they don't have reassurance about income continuity, that it probably interferes with reporting of symptoms and conditions. So it's very serious. And so in terms of income continuity, as already mentioned, WSIB is available, and workers who are diagnosed with COVID-19 due to a workplace exposure are eligible for WSIB compensation. Unfortunately, according to WSIB information very recently, workers who have COVID-19 but no symptoms, they may be eligible for WSIB, but that's decided on a case-by-case basis. We don't have the presumptive legislation that they have in BC where this would naturally occur. But in both cases, the employer needs to report this to WSIB, and then the chain of events after that is that WSIB will connect with the workers to complete Form 6 of the worker report. And WSIB has a lot of staff that is actually allocated to this. They're working with a modified Form 6, and they have quite a number of Spanish-speaking staff that are assisting workers to complete Form 6s. but they aren't being reported in every case. And so it is important to get the information out to workers and advocates that workers are eligible for this and to assist them with filing claims or initiating claims by a Form 6 or medical report. Other income replacement, workers who are exposed to someone with COVID-19 in isolation, WSIB at this point in time says that they are not being covered. However, on the next slide, it says that they should report that. But they also should be eligible for benefits through at least two other sources, which is the private carrier through Cowan and EI sick benefits. Maybe just flip to the next slide. So this is the slide that WSIB uses in their presentations around COVID-19 and reporting. And as you note, it says if your employer tells you that they believe that they've contracted it, or you believe there was a potential workplace exposure, that the employer is supposed to report that to WSIB. I did send an email to try and confirm whether that's an or an and in terms of those 2 points. But as already been mentioned, that in the WSIB stats page, that there are 353 claims in play, so it seems, and that I think that we're fairly confident to say that there are over 500 cases of COVID-19 amongst migrant farm workers. And remember that the stats reported by WSIB are all agricultural workers and not just migrant farm workers. And so I'm going to turn it over to Val for questions.
Great, thank you very much, Michelle and Eduardo, and also Ron and Denise for your presentations, and Donald, who are all still here. I think it was only Vince who had to leave. A lot of material. We squeaked it in our 90 minutes, but I know that people may want to ask questions of the speakers. There's only one other comment in the chat box right now that talks about reprisals, and that there's a number to call for a worker who's reprised against. But upon calling the hotline, what protections/services are workers provided after contacting the ministry, and how can they be guaranteed employment in subsequent years, which is a big question given the paradigm of their work, especially the Temporary Foreign Agricultural Worker Program. So I guess that's a question for Ron. But I don't know if anyone else has any other.
Sure. I can start off on it, and anyone else can weigh in if they like. So if we have a complaint of reprisal, for example, if someone called in and said, I raised a concern about ladder use, for example, and I was reprised against for one reason or another. So the Ministry of Labour, Training and Skills Development, we would investigate that claim as far as the health and safety concern is considered. So, for example, if it had to do with ladder use, and we go to the workplace and we do an investigation on ladder use, make sure that everything's being done properly, and if there are contraventions of the Act or the regulations, write orders to correct that. Whether or not the individual was actually reprised against is not a decision made by the inspector. That is referred to the Ontario Labour Relations Board, and they would make do an investigation and make a decision as to whether or not you were reprised against. And if the Labour Relations Board determines that you were reprised against, they can order remediation, everything from being rehired to financial compensation to, whatever remedy they feel is appropriate in the circumstance. That's their piece of it. But the Ministry of Labour, Training and Skills Development looks strictly at what is any of the health and safety matters around that.
Did someone else? So here's a question. Michelle, can you speak further about the designated clinics for foreign agricultural workers that help address non-emergency care, also hospitals seeing foreign agricultural workers in case they have a non-COVID related injury, illness, and has any part of that process changed now?
Yeah, that's a good question. Much of the assessment work by many clinics, primary care clinics, et cetera, is being done virtually. And this is the same with the clinics or the CHCs who have designated services for migrant workers. But they are very active, and they're seeing a lot of workers and hearing from many workers about some of it about COVID related conditions, but also about other conditions. I think the same thing can be said for emergency rooms. And many of the messages that you hear from healthcare workers and the Heart and Stroke Foundation, et cetera, is to not be afraid to go to emergency rooms if you have a serious condition, because they are being obviously very careful about protecting everybody's safety, and that if it is even on the virtual assessment with the worker, if it's deemed necessary that the worker should have an in-person assessment, that is arranged and that is being done.
Great. Thanks, Michelle. That's helpful. And I actually put the link for our temporary foreign agricultural worker and COVID-19 safety considerations page there, because we have posted the chart of the various ways to get help in all the different regions that you recently compiled. We put it up this morning. Anybody else have any questions that you can type in, or it would be possible now for individuals to unmute themselves and ask a question directly if they want to. I guess we have questions for you in terms of we were trying to share a lot of what we're thinking around some education modules, but still done with sort of slides and information. As everyone appreciates, there's a lot of sort of different aspects to prevention. Wondering if anyone has any feedback even on what you think the key challenges are, and or what information is not understood, or what more can we do, I guess. Any input or insights?
I have a quick question about language. I know that language, I think Eduardo mentioned language is a long-term, something long-term that we're looking at to enable, to ensure that workers, that these workers understand and they're properly educated about all these processes and the health and safety piece. Are all of the orientation sessions with regards to health and safety for foreign agricultural workers, do they always require an interpreter or translator to be present so that there's a clear understanding of what's being communicated in terms of education and guidance and best practices?
Yeah, I guess we can frame that. Can you hear me? I think I was muted before. Okay. I was going to say maybe that kind of as two pieces, because that could go to Ron. We initially had been asking about that as well, in terms of when an inspector would go to a workplace to kind of assess that everything's going on. We know that now there's, the need to show that, orientation or training has been provided, but we wanted to really understand whether that's being verified that it has been provided in the language of workers. And I think the ministry had said that that would be the case, but I don't know if, Ron, if you have any clarity on that.
Always many times with farming and agricultural field visits, there's a language barrier component to it. So some of our inspectors have their, have second and third languages that assist in that matter. But we also have translation services available to our inspectors should they feel it's necessary during a particular inspection. I know myself, I started as an inspector in the industrial program, which also looks after farming and agriculture. And, I personally have done investigations where I've had translators come with me to help ensure that level of knowledge at the worker level to ensure that the workers are actually understanding it in cases where they can't speak English.
Well, but in terms of when the inspector does kind of identify what has been done by the employer, I mean, in terms of orientation to the workers, does the MOL inspector verify that the orientation that was done by the employers was done in the language of the workers?
Well, you have to be able, you want to make sure that one of the questions I'll ask is what are the languages in the workplace, and how do you reach out to those individuals? So that is part of it. The challenge is if you want to actually drill it down to the worker level, actually speak to a worker to ensure that they got all that knowledge that the employer is saying they delivered. You want to ensure that, if you wanted to ensure they actually absorbed it, learned it, and remember it, that can be a challenge if they don't speak English. So that's where translation services may come in.
Yeah.
So there's another question from the County of Essex. Actually, has the Ministry of Labour used other locations to educate migrant workers besides the workplace, such as migrant worker centers, service clubs, and churches? It's community organizations which we work with a lot because they do support workers in the areas. I guess, has the ministry ever thought of engaging with
so we have obviously a ton of information available on our website and various social media avenues that we use to try and get information out there. Christy Eve, our provincial specialist, she goes to a lot of these community events and fairs, things of that nature, where we know that workers are present, work fairs, to spread the information and hand out documentation that we've translated into various languages to provide those resources directly to the workers.
Okay, thanks. Eduardo, did you want to talk anything further about some of our community presentations that we've done in the past, or some of the community networking?
Sure, I guess, we've often, tried to hit those community levels as well, recognizing again, as we touched on, to make sure information just getting to workers at whatever level, as we then work focusing resources to the employers to have that as well. I did also want to kind of circle back just really quickly to Stephanie's question about reprisals, just because I do think that that's something that's so key to this in terms of, again, ensuring that workers understand, their rights, but also understand the process that would actually then protect them to assert those rights. So I understand that, if there's value in the MOL, in a report for a reprisal to trigger, from a health and safety perspective, looking at what could be the issue, because then, hopefully that issue's clarified. But in terms of then, we might really need to prioritize looking at the Labor Relations Board and really looking at stats or trying to identify. And I know a lot of the worker groups probably have workers who've, troubleshot these systems. And so we really need to maybe pull from those experiences at what that has looked like for workers dealing with the Labor Relations Board. Because in our opinion, we have done a lot of work even getting workers to become familiar with the MOL's contact center calling. And so I know Christy has done a lot of work to let us know what that process would look like, to identify what it takes for a worker to even get through the automated English part to then get to somebody where they can then ask for a translator. So we've kind of pushed a lot to have workers understand the process, because what we find is that if a worker doesn't really understand, or it's not even understand, it can't picture what it's going to take, what their experience is going to look like as they, report or appeal to something, there's less confidence to do so, right? So if we can really clarify what, if the Labor Relations Board route, what that looks like, and really be able to articulate that to workers, I think that's, is really a really needed priority, and make sure that it works, right? And I could see from a lot of experiences from some of the advocates probably have a lot of experience with that. I don't know if anybody has comments on that or experiences with workers on that.
I guess not. Great. I don't see.
Oh, can you hear me, Val?
Yes.
It would help if I moved my mic down. Hello, everyone. And so we just found out here in Windsor, Essex, that we are the last part of the province to still be in phase 1. And the mayor's upset, all kinds of people are upset. And I guess, so I have a couple of questions. One, for the session that you just had with employers, was Windsor Essex County represented? Does, what needs to happen there? Because the assessment clinic in Windsor Essex was very underutilized last week, and seems to be a combination of some workers, rightly so, being fearful of being tested for the reasons you talked about before, but maybe some reluctance on the part of some employers. Do you have any comments about that? Where should we be putting our efforts here in Windsor, Essex?
Good question, Catherine.
Yeah.
Like, I guess Ron, I don't know if, or I guess Vince is gone. He's the person from that area, from the ministry office there.
But also, I believe they mentioned mobile units going to farms now. So that's what was
Yeah,
mentioned at the conference. So
yeah,
I think that's the next step. So, because that's what they started doing before they opened the testing center. There were, the Leamington Hospital line was going to some farms, and then they opened this big center, and that was a fiasco. And I want to know why it was a fiasco, because Kathy, you mentioned a few reasons, but I want to know, whether we have any feedback from the workers as to why they were not going, whether they were expected to go during their workday, in which case, would they have been paid for the time that they would have taken off to go? And if not, if they were expected to go in the evening, then, they get home late and they're exhausted and need to cook and shower and rest a bit before going to work. So you can't blame them for not wanting to spend the time to go to the center. But the other thing, some of them may have been afraid to actually contract the virus by going to the testing center and being exposed to others. Then there's also question of transportation, if they're all on the same bus and they're not protected, that's another fear. So I'm wondering, whether anyone knows why they were not going and how these things can be addressed. So I think a mobile unit is probably a better solution. Well, it is a much better solution. So hopefully we'll have better results from that.
I think, Catherine, both you and Tanya raised the question: what next? There's been, as you say, in Windsor Essex, there's actually been a lot of community cooperation, and I have to say, as a clinician, I was so happy to see that response team that was checking on the workers who were in isolation, because it was not clear who was actually checking up on them. And it varies from location to location who exactly is caring for these sick workers. And at this stage of the game, there's a bunch of opportunities in play, and I understand the Ministry of Health is collaborating with OMAFRA about looking at repeating the Windsor model in other areas. But I think that you're saying that the Windsor model isn't working. And so there are so many people who have a piece of the solution of this, that this discussion seems like it needs to go beyond the people who are having a discussion. Because Tanya, you raised a lot of really valuable points in terms of why aren't workers going there? for testing. To be honest, I haven't had the test myself, but I know people who have would not want to have it repeated again. So the idea of having repeat testing every couple of weeks, I can see that people may balk at that. But I think the answer to your question is beyond perhaps the walls of the people who are having the discussions.
Yeah, I agree, Michelle. I mean, there has been a lot of community cooperation here, but it seemed to take, I think because of who's responsible for what, it was wonderful that finally a response team went to check on workers, but that was after both tests here, at least one of them. And again, it's difficult to know where to start.
Thank you both, Catherine and Tanya. And I think we do welcome more dialogue on that, but it's very complex, and it's very, reconciling what is appears a mild illness in many people with the severity that can arise in people of all ages, particularly those with any underlying health conditions or comorbidities. It's that we have to treat it as a serious risk, even if it's presenting mildly. I think has been kind of the conundrum, and some of in many sectors, not just the agricultural sector, are kind of slow to catch up to the level of severity. On the other hand, also it's a whole new world to try and not just run a farm in a time sensitive place or sector, but now with all this guidance from so many different levels and so many different issues to consider, it's quite challenging. There is a question that Leah left. She wanted to ask, I think this is a question for Ron again, around under what act or legislation are the field visits taking place? So is it clearly the OHSA, but is ESA involved at all in what you're looking at when you visit the farms as part of the initiative?
So the initiative that we're currently underway on is our health and safety inspectors enforcing the Occupational Health and Safety Act and its associated regulations. There really isn't an employment standards component per se, unless they become aware of something, then we would flag our inspectors on the employment standards sides to look into those.
Okay, so kind of keep an ear out, but it's not the intent. There's a question from someone about accessing employer resources from the earlier session, which we can put you in touch with the host of that, and also employer resources that our organization would be able to. And WSPS, of course, has recently updated their content, which we could look for that link and paste in here. But also we will be following up with everyone who registered on Eventbrite. We will post the video version or the recorded version of this session, as well as the Ministry of Labor one, sort of separated out so it can be more accessible to workers or employers if they're interested. And we will share our deck and the way we're considering to break it up in terms of bite-sized pieces as a playlist on YouTube or a similar site. But we will share that to ask for feedback from all of you in terms of what more or what less. Maybe that's the struggle with so many complexities, not to drown people in information. So we look forward to your continued engagement, and it is a session that we're developing for workers in video format, hoping that is more accessible than endless words. So I think that's probably enough for today, although we can stay on until 4 o'clock. That's another 10 minutes. If anybody else has anything they want to share dialogue about. But I think that we don't have any more questions right now. And I recognize that people are busy and that there's a lot of work needing to be done on many different levels. So. Oh, and thank you, Michelle, noting, yes, that they have, that they will host the deck, and the presentation from the noon hour session will be on the Ontario Fruit and Vegetable Growers Association. I think they sent a link to it already to people who are registered. And it was an initial baby step in doing parallel presentations at the on the same day that were circulated jointly. So we're hoping to build more bridges, and so that we can prevent this disease and other occupational health issues on farms for everyone going into the future.